Welcome back, everyone, to the Moms Like Me podcast powered by Support Now. I'm so excited to invite Diana Jenner from First Ascent to our podcast today. First Ascent is a partner of Support Now, and I'll have Diana share a little bit more about what they do. But what was really compelling to me about Diana specifically is not only does she do incredible work as a patient advocate, but she has her own story with cancer that I felt needed to be heard by our listeners. So, Diana, thank you so much for joining us today.
Thank you for having me. It's such a pleasure.
Of course, of course. So, for those that aren't familiar with First Ascent, you know I am completely obsessed with what y'all do. I think it is truly saving lives. It's so cutting edge. But for those that aren't familiar with First Ascent, do you mind giving people just a little bit of a summary?
Of course. So, First Ascent Biomedical is a functional precision medicine company. So, instead of guessing which cancer drugs might work based on population averages, we test a patient's live tumor cells against more than 150 FDA approved therapies in the lab to see what actually kills the cancer cells.
Yeah, and it's incredible because think of in a very practical use case that some of the things we've heard from cancer families along the years is that it's very challenging to figure out what's going to work for your kid and what's not, and time is not on your side when you get a cancer diagnosis. So that speed to understand what the best treatment or the best approach could be, I mean, truly, like it saves lives, and I think
Right.
it's like the best of AI. I think AI gets a really bad rap
It
and
does.
machine learning gets a really bad rap, but, like, this is one of these use cases that is so incredible in terms of how we can use these things to create more life for these kids.
Right. So, we actually combine real time drug response data with genomic sequencing and return the results to the doctors within 10 days, which is
Incredible. Incredible. Incredible.
incredible. That's
Yeah.
really all there is to say. It's incredible. It's
So
life changing.
yeah, life-changing, and as I've heard before, like, you've taken First Ascent has helped take children from hospice home.
That's right.
It's amazing. So, Diana, you are patient advocate. I know that, making sure you lead with purpose, given your both professional and personal journey is super important to you. And you don't come to this just from the goodness of your heart, although I believe you're very good. You have your own story. You're a mom of three. But I'd love for you to share a little bit more about your son, Logan, which, to my understanding, really was the catalyst for you to enter into the cancer world.
Correct. So there's this saying I live by now. Our CEO, Jim, kind of like instilled this in me, and it's that buffaloes run into the storm instead of away from the storm. They run into them together because it's the fastest way through. And when my son relapsed from leukemia, that was the storm. And I realized that I could either freeze in fear or run straight in armed with information. And that was the relapse, right? But before that, Logan was diagnosed about around the age of 3 in 2019, and it was an acute myeloleukemia diagnosis. And although cancer sucks, right, and all cancer diagnoses are hard, his survival rate was still pretty high. Like it was a leukemia, and we have the standard of care, right, and that's what he received. And he was great. He got a bone marrow transplant from his sister. Was actually pregnant at the time. She came early and she was a 100% donor match to Logan, which was a miracle within itself. A year after that, he did relapse. And that's kind of where like our Cinderella story came crashing down a little bit. That relapse, it was approached differently because the standard of care did fail, right? And relapses are a lot harder to come back from. And I could tell right away when they told me, like his doctors' reactions, the nurses, they were not happy to see us back. They were crying. It really scared me
Mhm.
because you could tell his chances were a lot less. And I was sitting there in Sixth Tower. I say this all the time. People are like, what is Sixth Tower? And I'm like, well, that's the sixth floor at Nicholas Children's Hospital, where it was our second home, pretty much. We pretty much lived there on and off. And somebody comes in and they're like, oh, we're doing this study where they take, we take a biopsy pretty much, and we test the chemos that Logan would receive in the lab and see, what the outcome is. And I kind of didn't understand it at first. And my first gut reaction was, I don't want my son to be an experiment. And then she's like, it's going to be really easy because it's just a lab draw, right? Like when they take his regular CBC, his blood, we'll take an extra one and we'll send it to the lab and they'll test. What really got me was that she said, it could really help other kids.
Mhm.
So I thought to myself, well, if Logan doesn't survive this and something like a simple lab draw can actually help other kids, like at least we made a difference somewhere, right? And that's it. It went from there. It went to the lab. The doctors and the scientists, they did their thing. Dr. Fader, Nicholas Children's, Dr. Azam at FIU, they worked together. Behind the scenes, I didn't know, this was really going on. It's just something that was, I have 3 kids, like you said, managing everything. Like this was the last thing I was thinking about, right? Dr. Fader comes in, a few days later and she tells me, we're not going to give Logan this drug. We're going to give him this combo drug that came back, from the test. It looks like it'll work better. Well, Logan went into remission instead of 150 days. Like the first time, he went into remission in 33 days.
Wow. Wow. That's incredible. Diana, I want to go back a bit to the moment that you realized that the leukemia had come back. Firstly, let me ask a more specific question. How did you know? What symptoms was he displaying? How did you know that something was off?
So I'm going to tell you the first time, right, when he first got it, he
Yep.
had pains in his bones, in his knees, in his arms. He wasn't sleeping, like he was in pain. I went to the doctor. They're like, oh, it's, a cold. Okay, I went to the ER. They're like, oh, it's chicken pox. And I'm like, man, can I just have a CBC? And they're like, no, like we know what it is, and then he was in so much pain. He was getting bruises. He had high fevers that wouldn't go away. And I was like, I just want a CBC. Like, how difficult is that? They gave it to me. That was the first time. The second time, it's sadder in a way because he wasn't displaying any symptoms, right? And I would take him I think once a month at that point to get a checkup. And when you get a checkup, they give you this little paper with the CBC results. And I understand it now, right? Which I didn't understand before, but now I
Of
can read
course.
it to you and tell you what I
Of
see.
course.
And it was the day before my birthday. And I'm like, Logan, my birthday's tomorrow. Let's go get my paper that I love. It just gives me that like relief for one more month. And that's when we saw it. I went with one of my
Wow.
best friends. She was over, at the house. We were having donuts with Logan and a pre-birthday celebration. Let's go get our paper. She actually used to work at Dr. Fader's office. So she came with me and thank God she was there because I fell apart.
How old was Logan at that point? 5?
He was 5.
How much did he understand?
The first time he was sick, he was doing what we were doing what we had to do, right? That was the mentality. I was pregnant. I was trying to protect Mary Jane, who I was pregnant with at the time. The mentality was like, let's go, let's get this chemo, let's get our medicines, let's get better. The second time, at the beginning, he felt really bad that it was my birthday, and it crushed me really because he's like, we're here and it's your birthday. And I'm like, that doesn't matter. Like, I'm always going to stick by you. And it's just another day, right? So I think he was kind of like gripping onto that to kind of like put his own understanding to it, right? Like it's my mom's birthday and we're at the hospital. Like that doesn't make sense, right?
Mm.
The throwing up, the me having to help him again. Like I think that's where he started realizing like we're back on this boat where like I'm not a kid, outside playing with my siblings, with my new baby sister, which he is obsessed with. He adores her. And his brother playing basketball outside. I think he came to understand it even more so when Good Morning America kind of picked up this story and he saw us on the news and kind of explaining like the truth that he could have passed, right?
Yeah.
I think that's when he really understood it for what it is.
Yeah.
At the moment, at 5 years old, he was just like, I'm sick and I can't go to school and I can't play with my friends and my siblings.
Diana, when the relapse happened, what did you need? You talked about at that point 3 kids in the world, a son with cancer. What did your needs look like, both emotionally and day to day?
It's funny, me and one of my best friends had this saying in college, like, no faith in humanity, right? Like, we have no faith in humanity because, humans do bad things sometimes, right? And when Logan first got sick, I went back. She's actually a cancer survivor. And I went back to her and I'm like, my faith in humanity is like so big. If one good thing has come out of this is how our community wrapped its hands and its arms and everything they had around us. Like we have a foundation now that we didn't start. It started with a meal train by Logan's baseball coach's wife, which is now one of my best friends. Started with a meal train. And they took it from there. They had yoga events to raise money for Logan. They made Team Logan shirts. And they were all I needed, like their help. Like they didn't like ask what I needed. They just did it. And I was
Mm.
actually reading this book, Let Them, last night, and it talks about when people need help, they already feel like a burden, right? Like I felt like a burden. And they don't know to say, like, bring me food or, pay for my Uber or whatever. They're just like, no, it's okay, I'm fine. Right. But they do need a lot of help. And emotionally, one of my best friends put me in touch with a therapist. She took me on for free. She doesn't take insurance, but she took me on as a patient, to try to help me walk through what that relapse was like. Because the first time I had to be strong for my baby that I was carrying at the time, the second time it really like just took everything from me emotionally, mentally. It was hard.
So you talk about community and the importance of having others lift you up. It sounds like you also invested in therapy, which I think is really smart. Something I often hear from other caregivers is just how important faith plays in this as well. Like just believing in something bigger and being able to center yourself in something else. Was that also a factor for you?
Yeah. So my best friend that I was mentioning, she started Team Logan. She's a religion teacher, one of the
Mhm.
Catholic schools down here in Miami. And relapse really tested my faith, like big time. It was like, how do we have this perfect ending, the Cinderella story? Your sister's a perfect match, like everything is great. And it just really tested my faith. I stopped asking God. So in my prayer, I wasn't like, can you please make Logan better? What I did instead was I shifted that to like being really grateful for like those really great moments. When his doctors would come in and tell me something good, or somebody showed up, or he was having a really great day. I'm like, thank you. Thank you for this moment. Like, I know you're doing what needs to be done to get Logan to the right place.
Right. So it just made you more present and
Yes.
more instead of longing for something more, appreciating what you had in that exact moment, no matter how small that win might have looked like to somebody else.
Right. Because we think we're in control, but we're not. And that is a big takeaway for me. I was a very controlling person, and cancer takes control completely off the table. You're not in control. God is in control. He has already written the story, and there's nothing that you think you might be asking for, something that is not really what is needed in the moment. So I was just grateful for every single good outcome.
So when Logan beat cancer the second time, I would imagine just such a heavy sense of relief. And help me understand, can it come back again? Like, how do you like what do the doctors say about cancer at this point for Logan?
So, after a bone marrow transplant happens, we're at the hospital through that whole entire process. And once we were able to leave the hospital, once he has grafted and his bone marrow is producing, that transplant by itself, we go in like every day, then every 2 days, then every 4 or 5 days, and every other week. It kind of like spaces out like that. And at some point, you're not supposed to come like Logan is going to be in October, 5 years post his second transplant, which is like that big milestone, like 5 years out. I still take him every 2 months.
Wow.
I want
Because you're
to.
pushing it or because the doctors require it? Okay.
Yeah, because they're like, you don't have to keep coming. And I'm like, no, but I will. And Dr. Fader, she's amazing. Like she has lived it with us. And if I have a question, if like Logan has a bump or a bruise or something, like I'll be like, hey, like I try not to. I try to
Yeah,
like, he's a kid, he's gonna get hurt, you know. But if it's something that's like triggering me a little bit, like she has no hesitation being like, just come in, we'll do a CBC. No problem.
that's
So
great.
every 2 months I still get him that CBC.
That's great. So you have that
And
peace of mind.
yeah. And it's something that's a constant in my head, whether like without knowing,
Right.
right? Like,
Well, and because of your experience with the relapse, where he was effectively asymptomatic, how could you possibly feel confident that everything is okay if you've had an experience prior that has shown you that it doesn't always show up in symptoms?
right. Correct.
Wow. So, Diana, I'd love to transition a bit to understand for you personally. So, all the while this cancer diagnosis was happening, the foundation was set up, through your friends, which I'm sure you have embraced yourself, of course. And as Logan continued down this positive path, how did you find your purpose in helping more children with cancer? And just talk to me professionally about how you decided, okay, it's time for me to look for a new opportunity.
So there's Team Logan, right? And that was the foundation that was created by our friends. And I wanted to shift that narrative from Logan to pediatric cancer. So I changed that foundation's name to the Pursuit of Happy Mess, right? Like instead of happiness, happy mess, because it's a mess and you try to make the best of it and find those moments to be grateful for. And we raised funds. We did soccer tournaments and whatnot. And what we did with that money was we gave it back to foundations that showed up for Logan. Leukemia Lymphoma Society, Make a Wish, things like that. But I don't like to ask for money. Like it's just not something. I don't know if it's that needing help. What we were talking about earlier. Like I just don't like to ask. It's just not. I think a lot of people don't like to ask for help, for money, for anything. So I kind of, stopped doing fundraising and stuff like that. But I want to be involved. Like I want to make a difference in a way that is significant. And I feel like that's what First Ascent does. I was at a Live Like Bella symposium. So let me backtrack a little bit.
Sure.
After Logan has relapsed and he's fine, I go to a symposium, Live Like Bella symposium, where they invite scientists and doctors and parents to sit and, discuss science and upcoming things for pediatric cancer. And there's this lady and she's presenting some results from her findings. And she's like, patient 13. She's like, a AML patient with relapse FIT3 mutation. And I'm telling you, I was in the back of this room. Nobody knew I was there. I went by myself and I go, that's Logan. She's talking about Logan. Like, I get goosebumps every time I say the story because it was a God incidence. She comes off the stage and it's lunchtime and she's at her board and she's talking to some people and like very like quietly, I'm like, hey, I kind of think that's my son. And she's like, tell me about him. And I was like, well, AML, relapse. I was like, steroids showed that it grew his cancer instead of helping it shrink. And she's like, oh my God, he's patient 13. So that's how my relationship with Dr. Azam started. She called, the
You just
CEO
gave
of
me
the like,
chills.
I have chills right now. I promise you, it is. It needs to be in a movie because it's something that you don't hear.
Yeah.
About
Yeah.
scientists and doctors and patients just coming together and like that whole experience was mind blowing. She was in shock. She was in tears. She calls the CEO over. She's telling them we end up on Good Morning America. Like this story gets like thrown everywhere. And then so I'm at the Live Like Bella symposium again this past year and I meet with Jim. He had actually been talking to me before he knew who I was the first time I went to the symposium. And I see Jim and I'm like talking to him and I'm like, like I'm really looking to like do something meaningful with this. I
Yeah.
was speaking that year at the symposium. I was on the board to speak. And he goes, okay, well, reach out to me. Like, let's see what we can do. Like, Logan's story is a part of First Ascent story, you know?
Yeah.
And that's how I ended up where I am today. And it doesn't feel like a job, to be honest,
Right. You
at
get to
all.
be who you are and do what you would naturally be inclined to do anyway.
Yeah.
It's amazing. It really is
It's
amazing.
it's a gift. It's a
Right.
I tell Jim, like, First Ascent has given me 2 gifts. Like, they saved Logan,
Oh.
right? And now they've given me this gift to be able to, like, help other parents and adults as well, because they take adults to help them understand the science really simply, because it really is simple at the end of the day.
Right. Right. So, as we begin to wrap up, one of my questions is for you. For these families that you meet through First Ascent and otherwise, what's one of the first pieces of advice that you give to these moms, to these caregivers?
Really follow your gut. Like, that mom gut is so real and so reliable. Ask the hard questions. Don't be afraid, you know? It's hard to understand.
Yeah.
Like, we're not doctors, we're not scientists, but I want to understand what is happening to my child, from beginning to end. And a lot of the times, doctors will be like, wait, hold on, like, let's get there, right? Yes, live in the present, understand what's happening now, but I also want to know, what's going to happen after my son receives these medications. And that's something that I think First Ascent also offers is they tell you what works, but they also tell you what doesn't work.
Right.
And if
Right.
it wasn't for that test, they would have given Logan a cardiotoxic drug that could have damaged his heart long term,
Right.
you
Right. There's
know?
all these trade-offs and side effects.
Right.
Yeah, I think the follow your gut and that mom gut feeling is so undervalued.
It
It's like, we
is. And
carried these things, like, there's some attachment here. This isn't fantasy. It in some ways, it's at some point, someone's gonna link the mom gut to science,
I
and
hope
it's like it's
so.
saying that this isn't something you're making up. This is something that you actually share with your child, just given, the way that we develop our children in gestation, and I think to your point, it's so overwhelming for cancer moms because most moms in these situations, they didn't go to school for this.
No.
And it's easy to be taught and to be assumed that you're supposed to know what this means, and chances are you have no idea, and it's okay to ask a million questions until
And
you understand it.
I'm so happy you elaborated on that, because when you asked me the question, I'm like, I'm gonna say mom gut, and I hope it doesn't land flat, because I really believe in it,
Yeah.
Like, aside from mom gut, sometimes the doctors would come in and they would ask me questions, and I'm like, ask Logan. He's sitting right there. And at 3 years old, he could point to where it hurt. He could tell you what was wrong.
Mm,
Like, I raised him in a way to understand his body.
right,
And I think
right,
that's really important,
right.
you know? And I think one more piece of advice is always being really open with, like, your kids and helping them understand themselves and the world around them, you
Yeah.
know?
Well, and you have no choice, right? When your child has that severe of a diagnosis, the way that you look at the world, the way you look at your body, it shifts.
100%.
And it's a blessing to be healthy, and you also become keenly aware of when things feel different. And, of course, we don't no one ever wishes these diagnoses onto children or to anyone, and there is that silver lining of that he'll go through life forever kind of understanding his body, understanding his instincts in a way that people that haven't had to face this simply can't. They
Yes.
just can't.
Him and his siblings, I think we talk about it very
Mhm.
openly. There's this one comment I received one time. They're like, oh, but, Logan, the kid that eats organic and this and that, and he got sick. And I'm like, ouch, that hurts. We still do that. We still are very mindful of what we eat. We're still very mindful of what we wash our clothes with, like, what we clean our house with, where we go, like what we're exposed to, because in general, that should be the consensus, right? Like, even if you didn't have cancer, you should still be aware of those things.
Absolutely, absolutely, and no one says that it's foolproof. No one says, "Oh, if you follow this
Right,
playbook in life, you'll never get sick."
right.
But there are things that in life that we can control, and those that can be controlled, parents have the option to pursue that and in an effort to put their best foot forward.
100%.
And that shouldn't be shamed, by the way. That's really terrible. Diana, no surprise, have loved this conversation with you. You're such joy and light for people that might be earlier in this experience, and I think that you've shared so many practical tips as to where people can find support and how to think about these things. As we wrap up, I'm curious, where can people find more information about First Ascent or even about the foundation so that they can support you or the efforts of Logan's foundation further?
So I've stepped away from that foundation. I'm really focused on the advocacy work I'm doing at First Ascent.
Wonderful.
I changed actually my Instagram handle is my fab advocate. So First Ascent Biomedical, my fab advocate, which I love, by the way. And I'm actually probably going to start our own podcast inspired by you. I want to call it the Buffalo Club. So, we're running into the storm. We're facing this together to try to shorten it and make it, as fast as possible, get everybody the help that they need as quickly as possible. And having partners like you guys is a blessing because, we do have like the Florida Fund, for example. If you're a Florida person, adult or child with cancer, you're covered by the Florida Fund for now. So we're having people that are coming from all over the states and, different countries. So having you guys, on our website as a tool for them is so, impactful. And I really, really appreciate you partnering up with us and helping us support the people that can't afford the test.
Thank you. Well, Diana, thank you so much. The Buffalo Club, my fab advocate on Instagram and
Yes.
TikTok, or just Instagram? Where are we?
Instagram for now. I'm a
Instagram for
millennial.
now.
I'm not on TikTok yet.
Okay, she's finding her Gen Z-ness. It's coming. I can feel it. She's
You
gotten
feel it,
there.
right? I'm trying to brew it up. Let's see
I
what happens.
understand. I understand. It took me over a year to get on TikTok.
Okay, good, good.
Diana, thank you so much. Look forward to supporting your efforts in the many days and months to come. And again, thank you for your time today.
Thank you so much.